So you're talking about healthcare. Do you support Medicare for all? I do support Medicare for all. Um, I very much support Medicare for all. I think it is the most realistic way of getting to universal healthcare in the United States. If you check my YouTube, I actually give a little talk about how people tend to have pretty messed up, a fair amount of misunderstanding about a lot of successful multi-payer systems. I think with the exception of Singapore, maybe. I need to actually read about Singapore. But like in healthcare systems like Germany, especially healthcare systems like the one in France and Belgium, which are often pointed to, they are successful multi-payer systems. And I think what people often see is that they are multi-payer systems where private healthcare companies run a lot of the systems going on there, and that they work in conjunction with government insurance. And they think that that means that a public option would be more effective than Medicare for all, which I think is a bit of a red herring. It turns out that multi-payer systems in European countries they involve a lot more government and a lot more regulation in order to allow them to work. I think that amount of regulation would be very difficult to institute in the United States. What do you say to people, conservatives who say the government can't find money to fund Medicare for all? Well, I mean, we're paying that money anyway, right? Healthcare costs what it costs. We are paying that money. The only difference is that money's coming from working class people, and it's coming from middle class people, and it's coming in. Well, I don't know. Like, we're not really paying it, but that debt is there, right? So now I am pretty sure at the cul-de-sac end of. So, yeah, we have a certain amount of healthcare cost in the country. Medicare for All does have a lot of different ways that it purports to reduce that cost, and a lot of those will work really well. But the truth is, right now, healthcare costs an insane amount of money, or healthcare costs a ridiculous amount of money. And I already got this, didn't I? And to say that we cannot afford to pay for Medicare for all when it's a cheaper version of the system we have now, and that cost is being paid in the form of extremely backbreaking debt. But it's levied against working people, and it's levied against middle class and working people in the form of unpaid healthcare claims, in the form of extremely high deductibles, extremely high copays, unaffordable premiums. These are all ways in which we are currently paying for our current healthcare system. So to say that the government can't afford to fund Medicare for all, no one can afford to fund our current healthcare system, and it doesn't make sense to say that working Americans need to foot the debt personally for an overpriced healthcare system instead of the public taking responsibility for funding a cheaper version of it. That logic just doesn't compute, in my opinion. And I'll be pretty arrogant about it. I'll say, like, that logic just doesn't compute in most opinions, I think. Like, it seems like a very dishonest argumentation. It seems like opponents of Medicare for All would then reply by saying the quality of healthcare would suffer if universalized. I don't know any specific data points they cite, but I've heard it be argued. The quality of healthcare. So the reason that the quality of healthcare is so high for people who can afford it is that there's scarce quality healthcare that is made excludable so that it can be at such a high quality for the people who can afford it. So right now, the way our system works is you've got a bunch of good doctors in the system, you have a bunch of bad doctors in the system. Or, good quality healthcare, bad quality healthcare. All of it is really scarce. Scarce here meaning not in kind of the hyperbolic way that people usually mean it, but scarcity in economics typically just means scarce just means there isn't an unlimited supply of something, right? So if you have a bunch of really good doctors, they can only make themselves available to a certain number of people, which means that ultimately they're going to charge a higher price in order to make sure that there aren't, a bunch of people trying to get appointments with them and trying to get their services in excess of what they're able to charge, right? This is how every market works. When something is in a higher demand than it is actually available, what will happen is the price of it will increase until eventually people will stop either being able to afford it or being willing to pay it. So the way that doctors work right now is that good doctors are very high in demand. There are way too few of them. There's a shortage of good quality healthcare services. And what will happen is that the good doctors will raise their prices until there are not, more people demanding them than are available, right? I'm just going to test the chat real quick. Okay, my chat works. My chat just refreshed, so I just wanted to check that it was working. So I'm a doctor who is used to charging $30 per visit. People realize I'm a really good doctor, and now 200 people want to see me. I only have 20 time slots in the day. What I'm going to do is I'm going to raise my prices until only those 20 time slots are demanded, or maybe 25 time slots are demanded. Because I don't want to constantly be bombarded with calls, and hey, if I can make extra money, I can make extra money. I'm a good doctor, right? I feel like I deserve it. So what happens if I'm a good doctor in high demand? Oh, that's not what I meant to do. So if I'm a good doctor in high demand, my prices go up. At that point, I'm making sure that I am not... I'm also making sure... So I'm making sure that I'm not overbooked. I'm making sure that my supply is meeting my demand. Or my quantity supplied is meeting quantity demanded, as my economics teacher would insist I say. But the... I'm not bothering with achievements. But the other thing that I'm doing that is not something that I would really take into consideration is I'm making it so that the majority of my customers are the people who can afford my services. So as a high quality doctor, I'm making sure that I'm only available to really rich people. So what winds up happening is that better doctors have higher prices and only richer people can afford them. Worse doctors have lower prices and poorer people can afford them. But the other thing that's happening is that all of the rich people can afford the good doctors, so they don't have any reason to make the worst doctors better. There's no incentive to make worse doctors better because, quite frankly, the people with all the resources in the capital, they're able to afford the good doctors. What do they care, right? In a single-payer healthcare system, better doctors are still able to get higher fees oftentimes. So if you're a better doctor, you're probably going to get better pay in a single-payer health insurance system. And the reason for that is that it's still a free market. It's just that the government is consolidating negotiating power on behalf of the consumer. So what winds up happening with the doctors is the better doctors still get better negotiating power because they're higher demanded. So the government's going to pay them more. The difference is that the consumer and the person who gets the better doctor is not determined by their economic ability, which means that there's a possibility that if you're not quick enough to the draw or if you're not lucky and you're really rich, you're going to get a worse doctor. And the benefit of that is that richer people have an incentive to invest more in improving the quality of all healthcare, in improving the baseline quality of healthcare. It's the same thing as making public colleges tuition free, or similar principle to making public colleges tuition free. Is when you incentivize rich people to send their kids to public universities, you also give rich people an incentive to actually make the quality of public education better. So right now, the reason that the quality of healthcare for people who oppose Medicare-For-All is so good is that the people who oppose Medicare-For-All have the money to afford really quality healthcare. And that quality comes at the expense of all of the people who cannot afford quality healthcare. We have a scarcity of healthcare services because people don't have an incentive to invest in making the quality of healthcare better and cheaper. And that excludability being the ability to exclude someone else from a quality product, that excludability is basically is created to work against the people who don't have the resources to make their own quality of healthcare better. So it's very easy to say healthcare is going to get worse if we have Medicare for all. That quality isn't going to suffer. So the overall quality of healthcare in the country, in my opinion, is going to go up. The quality of healthcare is going to suffer only for the people who had high quality healthcare specifically at the expense of poorer people. So yeah, the quality of healthcare is going to go down for really rich people because really rich people had high quality healthcare specifically by excluding it to poorer people. So in that sense, it doesn't bother me that much. But overall, the quality of healthcare is going to go up because you're putting skin in the game for the people who have the resources to invest in making healthcare better. That they suddenly have an incentive to actually make healthcare better for everyone, right? Because now they have to deal in the same system that everyone else does. Just some of the people who have experienced high-quality healthcare, which tend to be more healthy, may experience less quality healthcare, but not to be a detrimental amount to throw away Medicare for all, and this incentivizes the wealthy to help build the overall quality of healthcare through investment. Yeah, definitely. And there are going to be supplemental healthcare systems that, the rich people are going to have better quality. Ultimately, rich people are going to have better quality healthcare than working class people. Because we will have supplementary healthcare systems. There are going to be private healthcare companies that are going to cover things like copays or cosmetic surgeries and things like that. The wealthy are going to have better access to healthcare because they will have supplemental healthcare coverage that they can pay for and they can get. That's going to be fine. But under a single payer system, the baseline of healthcare, your primary coverage, right? Your primary care provider, your general practitioner, your physician, the doctors that you have access to, all of those are not going to be tethered to your socioeconomic ability, so you're going to have a stake in those. Do you think private healthcare companies should exist if Medicare for all becomes a thing? Yeah, I think they can exist. They can definitely exist, but they're not going to exist in the same way that they did under our current system, or that they do under our current system. The payer in single-payer healthcare refers to payers in healthcare systems, which is the payer is the person who pays the healthcare provider, so the hospital, the doctor. And in our current system, that payer can be any number of people. It could be the customer. It could be a debt holder, a loan person, someone who, intermediary, like a collection service. It could be your private insurer. It could be a combination of you and your private insurer. And we're going to get very, very soon, we're going to talk about the serious problem in a system where there's so many different payers and no fixed prices for healthcare services. That's a huge issue. But for now, one of the problems with having so many different competitors as payers is that a lot of these payers are private insurance companies. And a lot of private insurance companies have a lot of money, and what's more important to them than reducing the cost of the healthcare service they're paying for is maintaining the business of the hospital, which means that the hospital can charge them a huge amount of money, they will pay it, and then they will just, once they've paid it and they have the business of both the hospital and of their customer, the patient, they will just, what they'll just do is they'll increase premiums for the next year in order to make that money back because they have the leverage over their customer. For a number of reasons, right? The customer could have a doctor in the network that they really like, or, the difficulty of switching doctors, the difficulty of switching networks. Like, there's so many different ways that private insurance companies will kind of force you to stay with them even when the premiums go way up. And even when they're denying you coverage, right? So what happens is that because you have private insurers who are willing to pay really high prices, you have hospitals that will massively increase the price of healthcare. So in order to make sure that private capital is not competing with a government system, it is important to basically say we are going to be, and to make sure that doctors are not, to make sure that doctors are not basically selecting, good doctors aren't basically saying, I want to make that extra, like that 2 millionth dollar. So what I'm going to do is I'm going to enter this healthcare providers network and severely limit how much coverage I provide or how many services I provide under Medicare-For-All, right? Which is another problem, that doctors can limit the quality or scope of their services because Medicare-For-All is only willing to pay them so much. So to prevent doctors from artificially limiting the quality of their service in order to get paid more, and also to prevent private insurers from sabotaging the system by competing with all of the wealth that they have, it's important to basically say, hey, private insurers, you guys aren't going to be able to be primary healthcare providers. So private insurance companies will exist, but they can only provide services that are supplementary to Medicare-For-All. Here's a good example. So private insurance companies, so in Belgium, insurance companies that are fully privately owned are not allowed to provide primary healthcare services. I'm pretty sure they're not allowed. It's possible they just don't, but I don't see why they wouldn't. Maybe they can't compete. But I'm pretty sure that all primary insurance providers have to be mutually owned between the public and private companies. Feel free to fact check me on that, though. I have a difficult time imagining a system in which private insurance companies are allowed to provide primary health care and they don't. So I'm pretty sure that's the situation in Belgium. So fully privately owned insurance companies can only do what is called supplemental coverage. And supplemental coverage basically covers things like cosmetic care, and the co-pays of whatever is provided in the mutuality system. So when I go to see a doctor, I will pay that doctor 30 euros for 30 minutes of their time. Of those 30 euros, I will file a claim with my mutuality, my mutually owned insurance company. I'll make a claim with my mutuality. My mutuality, which is my low cost, public insurance, they will give me 15 euros. And then I will file a claim because through my family, they have employer-provided private insurance. And my family's employer-provided insurance will then reimburse us for the other 15 euros. And that 15 euros is a copay under the mutuality, but under the supplemental insurance that we have, we also get reimbursed for the other 15 euros. So that's the role that private companies play. They do not compete with the mutuality, but they have an opportunity to make money, and ultimately they are not providing services that the public can otherwise afford to provide, so they're not really harming anyone, by doing so. So it's really important to kind of strip down and rebuild private healthcare in America, because right now private healthcare in America is designed around creating this excludability around the baseline of healthcare. And that's a serious ethical problem. It's ethically indefensible, I would say, to make something as important as healthcare excludable on the basis of your socioeconomic status. All right, and we're going to go to the wind farms. I think we'll just swim up to that coast. So, yeah, private healthcare companies will definitely exist. It's just they're going to provide a very different service from what they do now, because the service that they provide right now is a racket. Our entire healthcare industry serves to limit the it's monopoly abuse, right? It serves to limit the provision of quality healthcare in order to be able to drive up the costs. And the entire system needs to be kind of restructured. And, a public option is a start, because it creates the mechanisms for the government to compete in a healthcare system, and for the government to provide healthcare to people, which is, it's a start there. Obviously, like, Joe Biden has no intention to expand it beyond that, and that's a problem. But, Joe Biden is not the extent of democratic politics. So once we have a public option, if hopefully we can get it, I think the chances are good, especially if we get a Democratic Senate. I think it's very, very possible that we're going to have a public option within the next 5 to 10 years. And if we manage to get that, that is a good place for us to basically start pushing for more, and basically saying, like, the public option is good, but we're having trouble competing with all these private companies, and they're trying to sabotage. And that narrative building starts immediately, right? And it starts with saying, like, we're down to start a public option, but these are the problems that you're going to experience with it. And when those problems start to crop up, we have to not let Republicans and conservatives hijack the agenda of basically saying, like, you see, government-run healthcare doesn't work. No. Private companies are the ones making public healthcare not work. So it's the private companies that need to be reined in. And I think there's a lot of ground we can cover from there. All right, that's going to do it for me. Thank you so much for watching. If you enjoyed the video, be sure to like and subscribe for future videos. I'm going to be putting out new videos every day. We're going to be talking about global politics, the far right. We're going to be talking about healthcare. And if you want to join the discussion live, I stream to Twitch live at 1 p.m. on weekdays, Eastern Time. Otherwise, stay tuned. New videos every day. Thanks so much for watching.